Hello everyone, I am Dr. Ziyad, MBBS, MD in Health Informatics. I am also specialized in clinical terminology and medical coding. In this introduction to ICD-10-CM coding, we will be look at what is ICD-10 code, what is the purpose of it, structure of the ICD-10-CM code, how to find the ICD-CM code in the code book. What is ICD-10-CM? ICD-10-CM stands for International Classification of Diseases, 10th Revision, Clinical Modification. It's a highly detailed and standardized system used in the United States and many countries for healthcare systems to classify and code medical diagnoses and other health related conditions. What is the purpose of ICD-10-CM? First one is standardization. ICD-10-CM provides a uniform way to report medical diagnosis across all healthcare settings, hospitals, clinics, doctor's office, etc. This standardization is crucial for various reasons. Second one is billing and reimbursement. Healthcare providers use ICD-10-CM codes to justify the medical necessity of the services they provide to patients. Insurance companies and government payers like Medicare and Medicaid require these codes for processing claims and determining the reimbursement. Third one is data collection and analysis. By using a consistent coding system, public health organizations, researchers, and policymakers can collect, analyze, and interpret health data. This data is vital for tracking disease prevalence and trends, monitoring public health issues like epidemics, chronic diseases, evaluating the effectiveness of treatments and interventions, allocating healthcare resources, studying healthcare costs, investigating and preventing fraud and abuse. Fourth one is medical research. Researchers used ICD-10-CM data to identify patient cohorts, study disease outcomes, and contribute to medical advancements. Okay, what is the difference between ICD-10-CM versus ICD-10? The ICD-10, that is International Classification of Diseases 10th Revision, is the foundational classification developed and published by the World Health Organization, WHO. It's used globally for classifying mortality, that is cause of death, and morbidity data. But ICD-10 is the clinical modification of ICD-10, specifically adapted for the use in the United States. The National Center for Health Statistics, NCHS, part of the CDC, is responsible for developing and maintaining ICD-10-CM with authorization from the WHO. While ICD-10 focuses broadly on diseases and health problems for statistical purposes, ICD-10-CM expands upon the capture the level of detail needed for clinical care, billing, and research within the US healthcare system. How to find codes in the ICD-10-CM codebook? It involves a systematic two-step process. One is consulting the alphabetic index and then verifying the code tabular list. Let's see how the ICD-10-CM codebook looks like and what are the contents of it. Once you open the ICD-10-CM codebook, it will have the tabs to mark bookmarks. After that, it will have the table of contents. Then it will have the ICD-10-CM coding guidelines. After that, symbols and conventions, one page. After that, it will have the anatomical illustrations. After the anatomical illustration, it will have the main part, that is ICD-10 index to the diseases. So the index are arranged in alphabetical order. After that, you will get the ICD-10-CM table of neoplasms. Then you will have the chapter-wise ICD-10-CM coding. There are many chapters, all chapters arranged in alphabetical order. Different alphabet will have the different colors. Also, you can put tabs to identify the each codes A, B, C, D to Z. And finally, you'll have the external codes, and last part of the book will have the appendices. Okay, let's see the structure of ICD-10-CM codes. ICD-10-CM codes are alphanumeric and can range from 3 to 7 characters in length. Each character provides increasing specificity about the diagnosis. Character 1 always an alphabetical character representing the broad category, that is chapter of the diagnosis. Characters 2 and 3 are numeric, further defining the category. Characters 4 to 6 can be alphanumeric, providing more specific details such as etiology, the cause of the disease, anatomic site, the location of the body, severity, and other clinical details. Character 7, it's an extension. It is required for certain codes, especially for injuries and external causes. providing crucial information about the encounter. Common 7 characters include A. Initial encounter, used for the first time a patient is seen for the condition, including active treatment. D. Subsequent encounter, used for follow-up care after active treatment during the recovery phase. S. Sequelae, used for complications or condition that arise as a direct result of a previous injury or illness. Placeholder X for codes that require a 7th character but don't have enough characters before it. And X is used as the placeholder to ensure the 7th character is in the correct position. So let's see an example. For example, let's consider a fracture of the radius, a bone in the forearm. So the code S52 is fracture of forearm. It's a broad category. S52.5 is fracture of lower end of radius. This is the more specific site. S52.501, that is green stick fracture of lower end of right radius. This is even more specific type and laterality. S52.501A is green stick fracture of lower end of right radius, initial encounter for closed fracture. So this is full code with 7th character. So we will see in the next part of the video how to find the codes in real time. Okay, let's see how to find an ICD-10-CM code in the code book. You can find the code in 2 steps. The step 1 is locate the main term in the alphabetic index. The alphabetic index is your starting point. It organized alphabetically by diagnostic terms. So first you have to identify the main term. This is usually the condition, disease or injury itself. Think of the noun of the diagnosis. For example, acute appendicitis. So here the main term is appendicitis. Example 2, fracture of the shaft of the right tibia, initial encounter for closed fracture. So here the main term is fracture or tibia. Example 3, type 2 diabetes mellitus with diabetic nephropathy. So here the main term is diabetes or diabetic. So we'll see how to find these codes in the code book in the later part of the video. Once you find the main term, look for any indented subterms that provide more specific details about the condition, such as type, example acute or chronic, then site, example right, left or specific bone, etiology, example due to or with, complications like with hemorrhage with gangrene. So notes and cross references. Pay attention to instructional notes like C. It will direct you to another main term, and C also. Suggest checking another term for more information. A dash at the end of an index entry indicates that more characters are required in the tabular list. Okay, once you locate the term in the alphabetic index, then you have to check it with the tabular list. So the step 2 is verify the code in the tabular list. Once you have potential code from the alphabetic index, you must go to the tabular list to confirm its accuracy and completeness. The tabular list is organized numerically by code. First, you have to check the full code description. Ensure the code description precisely matches the documented diagnosis. Then, read all the instructional notes. The tabular list contains crucial information that may not be present in the alphabetic index. These notes includes notes, clarify the content of the category, excludes one notes, indicate conditions that cannot be coded with the current code, mutually exclusive condition, excludes two notes, indicate condition that can be coded with the current code if conditions exist. Both are not part of the same condition. Then you have to code first or use additional code nodes. Specify the sequencing order when two codes are required to fully describe a condition. Example, underlying disease first, then the manifestation. These things you will understand when you code the condition in the later part of the video or other videos. 7th character requirements. Many chapters, especially injury and obstetrics, requires a 7th character for laterality. For laterality, encounter type, A for initial, D for subsequent, S for sequelae, or other details. If a code is fewer than 6 characters and requires the 7th character, an X placeholder must be used for the empty character position. So I'll show you how to do that next part of the video. Then the laterality. Some codes specify right, left or bilateral. If a bilateral code isn't available and the condition is bilateral, you will code for both right and left. So those things are available in the guidelines. So you can learn in detail during the guideline classes. Okay, let's take 4 examples and we'll see in real time how to find the codes for each 4 examples. So the ICD-10-CM code coming as the manual hard copy books as I shown in the video, and it also coming as the digital version. So now aapc CPC allows both the version to use in the exam, whether you can select the manual one or the digital one. So in this example, I am using the digital code book and demonstrate you how to find the codes. So let's take the first example, that is acute appendicitis with peritonitis. So this is the alphabetic index of the ICD-10-CM book. So here first we have to look at the main term appendicitis. So I have located this the term appendicitis. Then you have to locate the subterm of acute. So I am going down and located acute here. Within the appendicitis, the subterm is acute. So acute appendicitis with peritonitis. So then you have to search for the subterm of with peritonitis. So here you can see peritonitis as the generalized one. So let's select this one. So in the manual book, you have to go to the bookmark of K, then open the K codes, and you have to search select the K35. But in the digital book, once you click this one, it will automatically lead you to the tabular list. So once you click this one, now you can see it says acute appendicitis with generalized peritonitis without abscess, unspecified as the perforation. So the main term, it is not mentioning about the with or without abscess. So you can't directly select that one. So let's go to the top. Okay, here you can select acute appendicitis with generalized peritonitis. So this code may be more suitable one, because regarding the peritonitis, it doesn't mention anything. So we can take it as the generalized peritonitis. So the correct code will be K35.2. Okay, let's check the other condition, that is traumatic fracture of the shaft of the right tibia, initial encounter. So here we have to start the search using the main term fracture. Let's go to the alphabetic index. So when you come to the fracture, it shows pathologic. But in our condition, it is a traumatic fracture of shaft of the right tibia. So this is pathologic fracture. But within bracket, it also says see also fracture traumatic. So this will be our code. So you have to go to the fracture, then go to the subcategory of traumatic. Okay, now we have come to the fracture traumatic. Here you have to search for the tibia. So the blue part, you can see blue start with A, acetabulum. So you have to go further down in the blue line and have to find the subterm tibia. So let's go further down. Okay, here you can see it's coming here, tibia shaft. So it is 82.2. Okay, now you have to go back the tabular list. In the manual book, you have to go to the S terms and you have to go to the 82. So in the digital form, I can just click this code and directly it will lead you to the tabular list. So just click this one. You can see S82.2 is fracture of shaft of tibia. S82.2 is unspecified fracture of shaft of tibia. But in our case, it is clearly mentioning the right tibia. So when you look at the subcategory, 82.201 is unspecified fracture of shaft of right tibia. So this is the correct code. Why unspecified fracture? Because it is not mentioning the type of fracture. For example, if you see other codes, transverse fracture, displaced transverse fracture, like that, they are mentioning the specificity. But in this case, the specificity is not mentioned. So the correct code will be S82.2.0, that is unspecific fracture of shaft of right tibia. But here it also reminds you that 7th character. So in this fracture type of coding, you have to add the 7th character. So when you count the code, 1, 2, 3, 4, 5, 6. So 6 digits already there. So 7th digit you have to use as the initial encoder. So you have to put A. So if it is come with the 5 digits, you have to put the X for the 6 digits place. Then you have to put A. So for traumatic fracture of shaft of the right tibia initial encounter, the correct code will be S82.201A. Let's go to the third example, that is type 2 diabetes mellitus with diabetic nephropathy. In this case, the main term is diabetes, that is diabetes mellitus. So then you have to go to the subcategory of type 2. So you have to go further down. Okay, you can see this is type 1. So you have to go further down to find the type 2. Okay, this is type 2. In our case, the patient with type 2 diabetes mellitus with diabetic nephropathy. So the first subcategory is with. So here you have to search for the nephropathy. So again, follow the alphabetic index, this orange color. Here you can find nephropathy E11.40. Nephropathy E11.21. So you have to be very careful with nephropathy and neuropathy. Both are look alike. So read carefully. This is nephropathy E11.21. So again, go back the tabular list. So once you click here, now you can see E11.2 is type 2 diabetes mellitus with kidney complications. E11.21 is type 2 diabetes mellitus with diabetic nephropathy. So there's no any additional exclusion or addition. So you can use the code directly. That is E11.21 is the correct code. So for this case, type 2 diabetes mellitus with diabetic nephropathy, the correct code will be E11.21. So let's check final example, that is chronic obstructive pulmonary disease with acute exacerbation. So here you have to take the main term as the disease, then you have to go for the subcategory of pulmonary. So let's check this. Okay, here the main term is disease or deceased. So in the disease, now we had to find the second category of pulmonary. So go down with the alphabetic. So follow the blue line of alphabetic order. Okay, now we have come to the subcategory of, that is blue line, pulmonary. It also within bracket says see also disease lung. So you can search this word going disease, then go to the subcategory of lung. So both are same, lung and pulmonary are same. So inside this, you have to search, this is a chronic obstructive. So you have to go for the subcategory of chronic obstructive. So immediately below here, it is chronic obstructive. So it says pulmonary disease with chronic obstructive. Diagnosis says pulmonary disease, chronic obstructive with acute exacerbation. So again, you have to search for the subcategory of with acute exacerbation. So within chronic obstructive, you can see with exacerbation acute. So this will be the correct code for this. So you have to confirm this with the tabular list. Again, you have to go to the tabular list, alphabetic J codes. So let's click this one. Now you can see the code chronic obstructive pulmonary disease with acute exacerbation. So they exclude chronic obstructive pulmonary disease with acute bronchitis. So if it is acute bronchitis, we have to code for J44.0. Lung disease due to external agents, that is other codes are available here. But in this case, is diagnosis correctly says chronic obstructive pulmonary disease with acute exacerbation. So the correct code will be J44.1. So this is the simple introduction of the ICD-10-CM coding. Please check my playlist. There are more videos regarding ICD-10 guidelines and how to find complex codes. So please subscribe my channel and stay with me. So if you are preparing for the aapc CPC examination, my channel will help you to solve the problems you are facing in your examination preparation. So please subscribe my channel. And if you have any doubts or any questions, you can put in the comment section, or else you can email me, or you can WhatsApp me to the email and the WhatsApp number displayed here. So please subscribe my channel and stay with me. Thank you.